Hi, welcome to another episode of Small Doses with Laura Stell. Well, actually, this is a bonus episode because we wrapped last week with our fourth season. Today, I have a special guest. She's a friend of mine. Her name is Sharon Alton. And I want to tell you a little bit about Sharon and a business that she has. So Sharon's been a registered nurse for 10 years, and she also has an online business called She's That RN. And with that business, she promotes self-care through healthcare with beauty products, candles, apparel, and accessories. She also has a blog and she has a podcast. Sharon is a licensed body contouring practitioner, and she's had several trainings in body contouring and post-op massages. Sharon recently opened a new business, and that business is called She's That RN Experience. And with this business, she partners with her clients to achieve their body goals through non-invasive methods. Her business is located in Lutherville, Timonium area of Maryland. She considers her work as a nurse and a practitioner as a ministry of healing. She not only touches your body, but she touches your heart, mind, and spirit. Sharon takes her years of experience as a nurse and applies it to her business by helping people to focus on what they want and what they need for themselves without judgment or body shaming. She takes a holistic approach in order to promote health and wellness as a whole, not as a separate from their desires to lose weight. I'll list the ways that you can locate Sharon on her social media down in the comments. Now let's get ready and go meet Sharon Alton at the She's That RN Experience. We'll be right back. So we're here at She's That RN Experience with Sharon Alton, and she's going to give us the tour. All right,
So when you enter the experience, or part of the experience is how you feel when you enter a place. And I know for me, when I enter an establishment, I like that peacefulness, that ambiance to be right. Mm-hmm. So we want to make sure that everything is welcoming.
It's looking right and welcoming to me.
And we have over here for some coffee and tea and things like that. I give my patrons pens if they like pens. Come on in. This is our seating area. I love this wingback chair. I want people to be comfortable when they come in. And of course my sign telling you that this is where you're at. She's That RN Experience.
I love that. Okay.
Straight over here, my sister has her own business with t-shirts and things like that, so she made all my signs herself.
Okay, shout out to sis.
Energetic Erica.
Yes, shout out, shameless plug.
Yes, shameless plug. She's the extrovert, not me. So all my little signs up here are from her, and my best friend has her own balloon business. Another shameless is plug. It's Your Party, Let Me Plan It.
It's Your Party, Let Me Plan It here in Baltimore.
Here in Baltimore, and she does travel. She's on her way to a big balloon festival.
Okay.
In another state. So
shameless
she did all
plugs.
That's right. She did all my balloon decorations. There was a huge, I don't know if you got to see it on IG.
I did when you
with the big,
started.
She had
that was
a
beautiful.
huge
That was beautiful. I saw it.
So this is just my storage closet.
Okay. She got cleaning supplies in there, y'all, and toilet paper. Lots of toilet paper.
Supplies. So over here is my little area where I set up. At first, I'm a Christian, so I believe in the Word of God, so that stays open for me. And I ordered some Our Daily Bread so that I can spread the love of Christ to those who come in my establishment. Okay. My last assignment, they gave me this box, and it has all these beautiful sayings on it. So I keep that out. These are my babies. This is what I'll strap on when it's time to get ready to come in there and sing.
Gear.
That's right. I still keep my stethoscope here because you never know what's going on, and I have a manual blood pressure cuff in case you're feeling lightheaded, dizzy, and I need to check your blood pressure. Right. I check temps when you come in, and if you don't come in with a mask, I'm definitely going to give you one.
Okay.
Because despite what people say, COVID is still
here.
running rampant,
Yes.
as well as the flu season is here. So, you know, too much that can happen.
Okay.
These are actually glass containers that are for sale here with my little logo on it. And I also have these for sale. I am also an author. So I have two
That's right.
different nursing books.
We have to purchase a book before we leave.
The one is Dads Are Nurses Too, and the other one is I Want to Be a Nurse Like My Mommy.
Let me see. Okay.
I have a nursing journal, and then I have an affirmations and manifestations journal
That's you
that
too?
you can write. Yes.
I do
All of
remember
these
seeing you post
are
that.
mine. And different things, and you can set your own intentions for the day, the week, the month. You can write your own affirmations.
So
out.
even if you don't need services, y'all, these books are awesome. And can they get them other places in here?
You can get them on Amazon.
Amazon.com.
You can also get them on my website. She's at rn.org is my online business, and they are cheaper if you get them through my website. Yeah.
Okay.
She's at rn.org for any of my books, and she's at RN Experience for any of my services.
Okay. Well, let's go check out
All right.
the service
Come
room.
in.
The client room 1.
Yes, client room 1. So this is my setup here. Again, concentrating on the experience that you have here and making sure that when you leave here, you do not leave feeling the same way that you come in. So I have created these posters here. So for BBLs, butt augmentations, abdominoplasty, which is your tummy tucks and your lipos, and breast augmentation. And this is to kind of show you where you're healing, where you are in your healing process, what you can kind of expect, look forward to when you can start doing things like exercising, what your body should look like, when you should actually be lifting heavy weights or not lifting heavy weights. So yeah, that's just like, it's not a set in stone, but it's just to give you an overall picture of some of the things that you can expect.
Okay. And these are things that your doctor didn't talk to you about.
Absolutely not.
Okay.
Absolutely not. I like mirrors because I like you to see yourself afterwards.
Okay.
Because as I'm using this equipment, you will start to notice subtle changes in your body. Wherever we're working, you'll start noticing, oh, I see where I'm coming in. Oh, I see this part of my belly going down.
So
Oh,
do you
my
do before and
thighs
after
are-
pictures?
I do.
Okay.
Yep, I do.
Those are awesome.
Yes. This is my infrared lamp. I use this during cavitation procedures. And cavitation is when we are shrinking the fat cells. And this whole get up over here holds all my equipment for body contouring. When you get post-operative treatment,
So does this vibrate?
no, this
No.
one has a loud ringing in your
Oh.
ear, and that's how you know it's working.
Okay.
But the provider is not going to hear it, but the patient should hear it.
Okay.
If they tell you they're doing cavitation and you don't hear anything, you need to say something because this emits a loud ringing noise.
Okay.
And depending upon how loud, we can turn that down, like if
Okay.
it's too much, okay? This is my vacuum. This is used to move the lymphatic, get everything moving into your lymphatic system. So after we
Okay.
shrink those cells, then I use this to help get that into your lymphatic system and working and operating. And these pieces are for skin tightening. So
Oh,
once
yeah.
we get enough of your fat cells shrunken down and you're eating right and you're getting a little exercise in, even if it's just walking, that skin starts looking loose, we start
Mhm.
working on that, tightening that skin, okay?
You plan a trip to Baltimore real fast.
Yes, come on. And wonderful
I
tables.
love this.
And I have a little bit of everything.
Oh, I love the waterfall.
I
That
do
is
the
so
waterfall.
calming.
Just for that reason.
That
And a
is
lot of
so
times,
calming.
again, when people are coming in post-op, they are anxious.
Mhm.
They're anxious. They are experiencing so much trauma in their body.
Mhm.
They're emotional. And so I turn on the waterfall to give them that peace, that quiet sound,
Mhm.
to give them a little bit of relaxation and let them know you're in safe, here's a safe space. You know, a lot of the industry, a lot of the people that tell us we're out of shape, we're fat, we're grossly obese, and all of that. Who wants to come to a place where you feel that way?
Yes.
You know, you want to come to a place where you can just be.
You just want to be.
Just want to be yourself.
You're good enough,
You wanna,
and you are enough.
Exactly.
You're just making some improvements.
Exactly.
Right.
I always say we're enhancing because you're
And
beautiful already.
That's it.
Your inside is beautiful.
You're beautifully
your outside
made.
is beautiful.
Wonderfully made.
Wonderfully
Just
made
make a few little
in
changes.
Christ likeness. So
Yes.
all we're
No.
doing is enhancing.
This is one of my favorite things because I also have one. It's a vibration plate, and we're going to let Nurse Sharon tell us how and what she uses the vibration plate for.
So the vibration plate, what I use it for is to stimulate the lymphatic system, and it gets everything moving in there. So you shake vigorously, and there are different levels. Some people like it, some people don't. I love it.
Mm-hmm. I do too.
Depending upon how much they can take is how much time I put them on there.
Right. Start out slow and build up. Right.
It can cause you, when you first get on here for the first time, people say, "Oh, I'm itching." You do, because you're that friction, your skin is shaking
Yes.
and vibrating so much that it causes that itching effect. But after the first time, usually you don't have any problems.
I love
And another thing I've noticed with using this is that it helps people have to go to the bathroom. So if you are suffering with constipation and things, this being on this thing for a few minutes, yeah, it can set your body in motion, get things turning and churning, and you'll be like, can I get off to go to the bathroom? And yes, I will let you do that. Some of the other modalities, dry brushing, which helps with your lymphatics and cellulite, and it also stimulates that lymphatic system. These wood therapy is used. If you're working, this one is specifically for the back. So if I was working on your back and your sides, trying to work the area.
Don't start nothing we can't finish today. Oh my.
That, you know.
Yes.
I have all kinds of little tricks and trades. And because I want, this helps me push
Okay.
when I'm working.
Mm-hmm.
And it helps to carve and, you know, get that looking the way you want.
Well,
But I also offer,
she
real
got
quick,
surprise in the bag.
is just for relaxation purposes. I try to make my people comfortable so they can put things on their eyes. I give them pillows, things that just make their experience feel really comfortable. And you're probably saying, what in the world is this for? If I have to do seromas, drainages, this is my table for that.
Okay. We're here with Sharon Alton, and I'm just going to ask her a few questions about her wonderful business. She's that RN experience. And with that, here we go with Miss Alton. Okay, so Sharon, tell me a little bit about your business.
So my business is a body contouring and pre and post-op indoor, which means we offer services for women and men who are going for cosmetic surgery. Let's be specific, because there are a lot of types of surgery, but this business is specific to cosmetic surgery. So when they finish their procedures, they need post-operative care, massages, which help them heal properly. They may come home with drains. During the course of their healing, they can develop what is known as seromas, and I can drain that for them. So that aspect is one area of specialty, but then I have the body contouring that is completely non-invasive. So that means that they don't have to go through surgery.
Okay.
I do the work with my equipment in shrinking fat cells and tightening the skin to get them that slimmer appearance in specified areas that they might be wanting to concentrate or focus on.
Okay, sounds like I have to make a trip to Baltimore real soon to tighten up some things. Okay, so how did you come up with this concept or decide that this was a field for you? Because I know you've been a registered nurse for many years, and so how did you come up with offering this service?
Beauty is a big industry. Nursing is truly my passion, and God told me it was my healing ministry. And in this area where women are body shamed, where they don't feel like they have a place to go to do what they want to do for themselves, a lot of people place emphasis on oh, you only want to do this because you want to look like what society says. And that's not always the case. Some people, yes, but most people, no. For me, I went through lipo, and I didn't have the information that I needed. My surgeon didn't talk to me about what I needed preoperatively, nor did he talk to me about what I needed postoperatively. So I was completely shocked. I wasn't prepared for the trauma that my body endured. I wasn't prepared for the mental anguish. I didn't have the capacity for all of this stuff going on at one time. So I thought, you know, in trying to get away from direct patient care as far as the bedside, this offered me an opportunity to be able to do something that I still loved. I still get to educate patients. I still get to develop, and more so now than at the bedside, I get to develop that trusting relationship with my patients, or my clients. I can't call them patients anymore, but my clients. And I can do that through holistic care for them, not just their body, but, you know, coming in and that overwhelming feeling that you might have from all this stuff that's going on in your body and you don't know, and you're crying and you're upset, and being there for them that way, making sure that whatever way they come in this door, they don't leave out that way. And they leave out saying, oh yeah, I'm going back to her because I was taken care of mentally, spiritually, emotionally, and physically, holistically, helping them heal inside and out.
Well, I know for everybody that knows this lady, that last part that she just said, it is so true, because you have this natural spirit about you, you always have, that everybody calls you when they're crying and upset and depressed and just miserable, and you just have such a wonderful gift, calling to speak to that. So, y'all, she got you with your cosmetic surgery procedures after the care, and she will definitely nurture you, your mind and your spirit, when you come in here and you just messed up. This is the lady. So, okay. So I'll ask you a technical question here. So do you accept insurance?
I do not.
Okay.
This industry isn't set up.
So technically it's not medical.
Right.
Okay.
It's purely a cosmetic procedure. It's elective, what
Right.
they would call elective.
Absolutely.
Which is why most insurances won't cover,
Okay.
even if you were going for surgery. It has to be a medical reason that
Absolutely.
you have to have the surgery.
Okay.
In order for insurance to cover it. So it's all out of pocket, but it's also really important for people to understand that component, because even still, I wasn't prepared for that component. So
Right.
you set yourself up to, I gotta make this balloon payment for this surgery or this procedure, but nobody told me I need to also budget in for what it's going to cost me afterwards, what that is going to look like. And
Right.
so people are shell-shocked when they come and they're like,
sticker price.
I didn't even prepare for that. I only prepared for.
Yeah.
So that's why preoperative consultations are so important, because you get so much information, from detoxing the body to detoxing the mind, what to expect, when you need to come afterwards, and of course setting up, understanding how much this may cost me, because
Right.
you need to budget that in.
Right.
And I don't care what they tell you, because my physician told me, oh, you're going to be able to get right back up and you'll be back to work, and I was not. My body was in no way ready. My mind was in no way ready. I was in such excruciating pain, and there was stuff happening to me that I had no clue about. And I required someone to help me. Like, I couldn't do it by myself. And they don't tell you that. Like, oh, you'll be back up on your feet. Yeah, no.
Yeah,
that's why it's
right.
important to have some consultations with the people that know afterwards.
Right.
What that's going to be like.
Because I've known of some people who have had the weight loss surgery, the gastric bypass or the sleeves or whatever, and they've lost the drastic weight, and then they have a lot of skin left over, and they didn't expect to have the skin left over, and then they have the cost of having the skin tightened or removed.
That's right.
And they're not prepared for that.
Exactly.
So I like that you're offering the information about, aftercare and before care. These are some things you need to know, because in the excitement of getting ready to have the procedure and seeing the changes, you miss the big picture.
Exactly.
You're pigeonholing on that one thing that you want. And so you don't see that, yeah, you want that one thing, but there's some other parts to it.
Definitely other parts to it.
Okay. Because I can see how not understanding that you can have a setback.
Yes.
And then before you know it, you've regained the weight or whatever.
Yes.
You've undone what you just paid to do.
Exactly.
Right.
And that is a huge, huge gap in the information that you receive or don't receive. Even as much as my doctor pretty much, now mind you, surgeons, they perform surgery.
Right.
Okay, I just want everybody to understand that. They do not perform aftercare. Not unless something goes surgically wrong.
Right.
If you did a hiss and you open back up or something, they have to go back in. They have no clue what's going on afterwards. So my surgeon, oh, you don't need post-op massages, but just rub on your stomach at home and you'll be fine. And then it just kept filling, and I developed all these lumps everywhere. The tissue would just, and it was so painful. And so when I finally reached out to someone, and they were like, "What?
Right.
You were supposed to come the day after your surgery." So yeah.
So how do people find out about your service? Are you connected with any local surgeons or?
I have not connected as of yet, but that is definitely my intention. We just had a big cosmetic service provider come to Baltimore that is in a lot of areas, and so my intention is to reach out to some of them and let them know that I'm here, that I provide services, and they can they're more than welcome to send their clients here. Right now I am doing marketing. I've printed flyers that I've passed out, that I've posted up. I have people that are at colleges and their workplaces passing out flyers, my
I've seen you on
cards, my
social media.
information. Yes, I'm trying to learn, I'm gonna tell you. I'm trying to learn this marketing thing because this part, I don't like being live. I'm not comfortable at all with that. So I am trying to do other methods like sponsored ads and things like that. I'm just trying out different things, because I am not that person that likes to be on live. I'm such an introvert, so yeah.
Yes, you are.
I'm working on it.
I'm surprised when I see you. I'm like, okay.
Usually I do videos and then just upload them because then it's easier for me. It's not easy, but it's easier.
It's easier
for me to just do a video and upload it than it is for me to go live and talk to people and strange people be trying to come in and join. I was doing it like as a challenge, and I would get on at 5 and it looked like Arabic writing, and they would always try to join my call and I'd be like, why? I don't know you. No, you can't come on and talk to me. I'm sorry. Like this is not what this challenge is for me to try to get comfortable, and so I didn't do it.
And you're going to get comfortable. You will. So I want to do a quick recap before.
Sure.
So we are here with Sharon Alton at She's That RN Experience.
Yes.
And what she does is she provides aftercare for people who have cosmetic surgeries, male or female.
Yep.
And she has a lot of things. I've already kind of done a sneak preview. And she's got all kind of bells and whistles in here that most of us have never seen. We don't know anything about. But anyway, she's here to get your body right. So you heard her say the surgeons are there to do your surgery. They don't necessarily always understand aftercare. And if you've listened to any of my episodes from this season, I'm not a doctor. I don't play one on TV. And I'm not trying to trash doctors. What I try to do is encourage you to ask the questions. So here you are, another example of a time where you need to ask the questions. And if your doctor tells you what her doctor said, that you don't need the aftercare, the massages and all of that, now you have questions and you've got someone you can contact to ask questions. And even if you're not in the Baltimore area, she might know of somebody somewhere else, and she might be able to help you find the help that you need moving forward. Well, ladies and gentlemen, I again am here with someone who is near and dear to my heart. And you have just seen the She's That RN Experience. So you know where to go if you're having post-op issues with your augmentations or any of your body contouring. No, she does the body contouring. If you have any of the surgeries, this is where you go to get those aftercare services that you will need. And Thank you again for watching and listening to Small Doses with Laura Sell. Before you leave, subscribe, click like, click share, and give this lady a call. We'll put her information down in the comment section for you. Thanks, and we're glad you tuned in. Bye.
Thank you for having me.
Sharon.
You're welcome.
Bye.
Bye-bye.